Soft tissue palpation of the knee. We're going to first begin by palpating the quadriceps as a group. We're then going to isolate out each muscle. We're going to palpate for the vastus lateralis. I'm just going to do a small tissue pull on the IT band that exposes the vastus lateralis, palpating proximal to distal. I'm then going to palpate the rectus femoris from the AIIS all the way down. I'm going to palpate the vastus medialis, which we can see easier on this side. I'm then going to take a small tissue pull to move the rectus femoris out of the way. And then I'm going to palpate the vastus intermedius. We're going to bend our patient's knee. And now we're going to palpate the first bursa, which is the superficial, it's the prepatellar bursa, just over the top of the patella itself. As I move down, I palpate the infrapatellar tendon, and up under that tendon we're going to palpate for the superficial infrapatellar bursa. We're now going to palpate for the meniscus. So to palpate the medial meniscus, I'm going to externally rotate the tibia. I'm going to find the joint line just below the patella, which is right here. As I push in, I should feel a little elastic rebound. That lets me know I'm in the joint line. So I'm palpating the medial meniscus. We're now going to move the foot into internal rotation, opening up the lateral aspect of the joint line, and we're going to now palpate the lateral meniscus. Okay. While we're here, we're going to go ahead and palpate our medial and lateral collateral ligaments. So on the lateral side, I'm going to palpate on the lateral aspect. If I need to, I can put a little bit of stress into the tibia, which will tense the ligament to ensure that I'm on it, palpating the lateral collateral ligament. The same thing would be true for the medial side. I'm going to demonstrate on the opposite leg. For the medial collateral ligament, which is right here, I can do a little external motion of the tibia to stress it, and then palpate the medial collateral ligament. I'm now going to palpate the area for the pes anserine, which is located just lateral and more medial, it's located more medial to the tibial tuberosity. I'm going to palpate the area of the pes anserine, and then I'm going to identify the three muscles that contribute to it. So the most inferior aspect is the semitendinosus, and above that is the gracilis, which comes from the adductors, and then the sartorius, which comes from the anterior thigh. So 1, 2, 3. We're now going to palpate the popliteal fossa by just putting our fingertips into the popliteal fossa and doing larger circular motions of the knee. I'm going to palpate the gastrocnemius muscle. So that's two muscles right here. This is the medial and lateral head. I'm going to contact both muscles, and I'm going to palpate up to where they attach into the femoral condyles.